Use your middle finger or ring finger. Massage your finger from your hand to the tip of your finger, and then massage the tip of your finger. Take the alcohol wipe and clean the tip of your finger. Let it dry. Then take your lancet, remove the safety cap, then push down firmly against your skin to release the needle. Wipe away the first bead of blood, then push against your finger to create a small pool of blood. Take your pipette and squeeze the end first. Place the tip where the most blood is gathered and release the end to suck up the blood. You should get enough blood for one drop. Collecting the blood sample can be tricky. Stay calm and carefully place blood in a test cassette well. Then collect more blood sample, if necessary. Add 2 to 3 drops of buffer according to instructions. Wait 15 minutes for your test results. Make sure to clean up your space from any blood drops.